A presentation of the University of Alabama in Birmingham Dental Television. Dental Anatomy. Maxillary first and second premolar. A telecourse by Dr. Barry Eisenberg, Dr. Wilson Wright Jr., and Dr. Michael Hughes. Maxillary first premolar. General characteristics. The maxillary first premolars are the fourth teeth from the midline contacting the maxillary canine mesially and the maxillary second premolar distally. They are identified according to the universal numbering system as teeth number 5 and number 12 and replace the deciduous maxillary first molar in the eruption process. The term bicuspid is often used when describing the human dentition. This presupposes two cusps, which often makes the term misleading, since some premolars exhibit a variation in the number of cusps. The maxillary first premolars are designated as the first posterior teeth from the midline. The first evidence of calcification of these teeth is between 1.5 and 1 3/4 years. The enamel layer is completed between the 5th and 6th year, with eruption usually occurring between years 10 and 11. Root formation is completed between the 12th and 13th year. The first premolar is basically a grinding tooth, which, along with the anterior teeth, contributes significantly to aesthetics as well as phonetics and function. The buccal aspect. The outline from the buccal aspect is basically pentagonal in shape. Compared to the maxillary canine, it is somewhat smaller in shape and has a less prominent cusp tip. Mesial outline. From the cervical line to the height of contour, the mesial outline is concave. The occlusal portion of the outline is convex, with the height of contour located at the contact area near the junction of the occlusal and middle thirds. Occlusal outline. The occlusal outline is similar to the incisal of the maxillary canine. The cusp tip is pronounced, although not as much as the canine. The cusp tip divides the occlusal portion into two slopes: the mesio-occlusal slope, which is longer and straighter, and the disto-occlusal slope, which is shorter and more curved, thus offsetting the cusp tip slightly toward the distal. Distal outline. The distal outline of the crown from the cervical line to the height of contour is straighter than of the mesial and may be somewhat concave. The distal contact is represented by a broader curvature than found on the mesial, with height of contour located at a slightly more cervical level than found on the mesial. Cervical outline. The cervical line is evenly convex toward the apex, with very little curvature. Buccal surface. The most noticeable feature of the buccal surface is the appearance of a buccal ridge, which extends from the tip of the buccal cusp toward the cervical. This ridge is comparable to the labial ridge on the canines. The mesiobuccal and distobuccal developmental depressions are found on either side of the ridge. Occasionally, the developmental depressions continue to the occlusal outline, creating a concavity or notch on each of the occlusal slopes. Root outline. Although there are usually two roots on the maxillary first premolar, only the buccal root is commonly seen from this aspect. The roots are usually shorter than the maxillary canine, convex in form, and taper to a fairly sharp apex. Occasionally, There is only one undivided root on maxillary first premolars. The single root is usually straight and tapers to a rather blunt apex. The mesial aspect. The general shape is one of a trapezoid, with the longer parallel side located at the cervical. Another characteristic which can be seen is that the tip of the cusps are well within the confines of the outline of the root trunk. This is representative of all maxillary posterior teeth. Buccal outline. The buccal outline is generally convex, with the height of contour located in the cervical third. Occlusal outline. The occlusal outline is irregular and is made up basically of the mesial marginal ridge and the cuspal inclines of the buccal and lingual cusps. The lingual cusp appears to be shorter than the buccal cusp. Lingual outline. The lingual outline is evenly convex, with the height of contour located in the middle third. Cervical outline. The cervical line may either be regular or irregular and convex toward the occlusal. The curvature is less than that seen on anterior teeth. Contact area. The mesial contact area is roughly circular in shape and is located at the junction of the occlusal and middle thirds, offset to the buccal. Mesial surface. The mesial surface presents a unique feature seen only on the mesial surface of the maxillary first premolar. This is the mesial developmental depression, which is located immediately cervical to the mesial contact area and centered on the mesial surface of the maxillary first premolar. The depression continues upward beyond the cervical line and joins a deep developmental depression between the roots, which ends at the root bifurcation. Another distinguishing feature of the first premolar is a well-defined developmental groove in the enamel, which crosses the mesial marginal ridge and is prominent from the mesial aspect. This is known as the mesial marginal developmental groove. It crosses onto the mesial approximately 2/3 of the way from the buccal to the lingual. Root outline. The root begins as a root trunk, which is that portion of the root between the cervical line and a point of furcation or branching. It then usually is bifurcated or split into two segments for at least half its length. The outline of the root trunk, as viewed from the mesial, is fairly straight and parallel, tapering apically from the point of furcation. The outline of both branches is convex and tapered to a fairly sharp apex. The buccal root branch is usually the larger of the two, although the two roots are about the same length. In addition to the single and bifurcated root types, there is occasionally a third root type, the laminated root. This type has the buccal and lingual branches joined wholly or in part by a lamination or thin connection. The lingual aspect. The crown tapers toward the lingual, thereby making it narrower mesiodistally at the lingual than the buccal. The lingual portion of the crown is convex in all directions. Since the lingual cusp is shorter than the buccal cusp, the tips of both are visible from the lingual. However, the lingual cusp tip is noticeably offset to the mesial. Mesial outline. The mesial outline is the same outline described from the buccal aspect. Occlusal outline. The occlusal outline presents a lingual cusp tip, which is pointed, but not as sharp as the buccal cusp tip. Being offset toward the mesial makes the mesial slope shorter than the distal slope. Distal outline. The distal outline is also the same as described from the buccal aspect. Cervical outline. The cervical line curves symmetrically toward the apex. Root outline. The outline of the roots from this aspect resembles that seen from the buccal, except the lingual root being somewhat smaller allows more of the buccal root to be viewed. The lingual portion is smooth and convex. The distal aspect. This view is very similar to the mesial aspect. Buccal outline. The buccal outline is convex throughout its length, with a height of contour located in the cervical third. Occlusal outline. The occlusal outline from the distal surface is very similar to that noted from the mesial aspect, with the exception that the distal marginal ridge is located more cervically, thereby allowing more of the occlusal surface to be viewed. There is normally no distal marginal groove present. Lingual outline. As noted from the mesial aspect, the lingual outline is convex, with a height of contour located in the middle third. Cervical outline. The curvature of the cervical line is less than seen on the mesial, and may on occasion even approach a straight line. Contact area. The distal contact area is larger than seen on the mesial, and is located at a slightly more cervical level. It is ovoid in shape, being wider buccolingually. The distal surface is generally convex and does not have the concavity normally found on the mesial surface. Root outline. The root outline is basically the same as that viewed from the mesial aspect. However, the root trunk extends more apically from the distal aspect. The occlusal aspect. The occlusal outline is roughly hexagonal or six-sided in shape, and wider buccolingually than mesiodistally. Buccal outline. The buccal outline is usually convex, exhibiting the prominent buccal ridge. When buccal developmental depressions are present, they appear as two slight concavities on either side of the buccal ridge. Lingual outline. The lingual outline is evenly convex, almost in a perfect semicircle. Mesial outline. The mesial outline is relatively straight with convergence toward the lingual. When the mesial marginal groove is prominent, it normally results in a dip in the mesial outline. Distal outline. The distal outline is relatively straight and uninterrupted with convergence toward the lingual. Occlusal surface. The occlusal surface, bounded by the mesial marginal ridge, distal marginal ridge, the mesial and distal cusp ridges of the buccal and lingual cusps, is made up of the following elevations and depressions. Buccal cusp. The buccal cusp appears to be centered mesiodistally in an occlusal view. It is located well toward the buccal and is slightly wider than the lingual cusp. This cusp has 4 cusp ridges, which are named by location. The buccal cusp ridge corresponds to the buccal ridge previously described in the buccal aspect. This ridge extends from the cusp tip onto the buccal surface. The lingual cusp ridge, also termed the buccal triangular ridge, extends lingually from the buccal cusp tip to the developmental groove, which traverses mesiodistally on the occlusal surface. The mesial cusp ridge extends mesially from the cusp tip to the mesio-occlusal angle. The distal cusp ridge extends distally from the cusp tip to the disto-occlusal angle. The buccal cusp also has 4 inclined planes, which are sloping areas located between 2 adjacent cusp ridges and named according to the ridges which they lie between. These are the mesiobuccal inclined planes, the distobuccal inclined plane, the mesiolingual inclined plane, and the distolingual inclined plane. Lingual cusp. As previously noted, the lingual cusp tip is located well to the lingual and offsets toward the mesial. It also has 4 cusp ridges and 4 inclined planes, which are located and named in the same manner as those of the buccal cusp. Marginal ridges. The marginal ridges of posterior teeth are located on the mesial and distal borders of the occlusal surface. These ridges run from the buccal occlusal angle to the lingual occlusal angle and are named mesial and distal marginal ridges by their location. The mesial marginal ridge is usually interrupted by the mesial marginal groove near its midpoint. Fossae. The maxillary first premolar has 2 fossae, the mesial triangular fossa and the distal triangular fossa. Both are triangular-shaped depressions located just within the marginal ridges and named according to their relative proximal location. Pits and grooves. There are 2 pits located on the occlusal surface, the mesial pit and the distal pit. The mesial pit is located at the point of union of the mesiolingual triangular groove, mesiobuccal triangular groove, the mesial marginal groove, and the central developmental groove. The distal pit, located just inside the distal marginal ridge, is at the point of union of the distobuccal triangular groove, the distolingual triangular groove, and the central developmental groove. Supplemental or secondary grooves may also be present. However, they are not normally given specific names. Maxillary second premolar. General characteristics. The maxillary second premolars are the 5th teeth from the midline, contacting the maxillary first premolar mesially and the maxillary first molar distally. They are identified according to the universal numbering system as teeth number 4 and number 13, and replace the deciduous maxillary second molar in the eruption process. The first evidence of calcification of these teeth is between 2 and 2 1/4 years. The enamel layer is completed between the 6th and 7th year, with eruption usually occurring between years 10 and 12. Root formation is completed between the 12th and 14th year. The maxillary second premolar bears a close resemblance to the maxillary first premolar and complements the first premolar in function. Consequently, from each aspect, only pertinent similarities and differences between the 2 premolars will be given. The buccal aspect. The buccal cusp of the second premolar is not as long or as sharp as the first premolar. The mesio-occlusal slope is slightly shorter than the disto-occlusal slope, which is the reverse of that found on the first premolar. The mesio-occlusal and disto-occlusal angles are not as prominent and consequently the tooth appears to be somewhat more rounded. Root outline. The root is normally single and tapers evenly from the cervical line to a relatively blunt apex. Its length is normally as great or slightly longer than the first premolar root. The mesial aspect. The cusps of the maxillary second premolar are nearly the same length. No mesial concavity is observed on this surface, but rather this portion of the crown is convex. There is no mesial marginal developmental groove. Root outline. The single root, as observed from this aspect, demonstrates a greater width buccolingually than it did mesiodistally. The root outline tapers rather evenly from the cervical line to a relatively blunt apex. The lingual aspect. Less of the occlusal surface is visible from this aspect due to the relative increase in length of the lingual cusp. The lingual cusp tip does not appear to be offset as far to the mesial as was observed in the maxillary first premolar. The distal aspect. The distal aspect is similar in outline and other characteristics to that of the mesial aspect. The contact area on the distal is slightly larger in size when compared to the first premolar, since the distal contact is with the first molar. Characteristic of posterior teeth, the distal contact area and marginal ridges are found at a more cervical level progressing in a posterior direction. The occlusal aspect. The line angles of the maxillary second premolar are more rounded, and consequently the crown appears to be less angular. The central developmental groove is often shorter and more irregular sometimes, with multiple supplemental grooves. The shorter central developmental groove results in a closer proximity of the mesial and distal pits, giving the appearance of being more centrally located on the occlusal table.